Bismillahirrahmanirrahim. Assalamu alaikum. This is Muhammad Anas Faruqi from 4th Prof Evening. My roll number is EP1770098. Today I am here to present a presentation on my topic, which is osteomyelitis and the septic arthritis. And my subtopic is osteomyelitis. Now, what is osteomyelitis? The osteomyelitis is an infection or inflammation of bone marrow and surrounding bones caused by infecting organisms. Its symptoms may be overlying redness, fever, or weakness. The long bones of the arms and legs are most commonly involved in the children's, while the feet, spines, and the hips are most common involved in adults. The previously, osteomyelitis was more common in children and adults, and the causative microorganisms was gram-positive cocci such as streptococci and staphylococci. Although Staphylococcus aureus remains the most common. Now, move to the next heading, which is the bone anatomy and the physiology. First of all, in order to understand the pathophysiology of osteomyelitis, we must have to understand the bone anatomy and the physiology. The bone is divided into three sections: the epiphysis, the metaphysis, and the diaphysis. The epiphysis and metaphysis are separated by the epiphyseal growth plate. This is the rapidly growing area of the bone, supported by many blood vessels. The blood vessels that supply bone tissue are located predominantly in the bone epiphysis and metaphysis. The nutrient arteries enter the bone at the metaphyseal side of the epiphyseal growth plate and lead to the capillaries that form sharp loops within the growth plate. These capillaries lead to large sinusoidal veins that eventually exit the metaphysis of the bone through nutrient vein. The blood flow is Now, the next is hematogenous osteomyelitis. Now, what is hematogenous osteomyelitis? Hematogenous osteomyelitis classically has been a disease of children, although the number of cases reported in adults also. So, osteomyelitis in children tend to be acute and hematogenous and is often responsive to antibiotic therapy alone. In comparison to the osteomyelitis in adults, tends to be subacute or chronic or commonly results from the trauma, prosthetic devices, or the other. So, as a result, the surgical debridement often is needed in addition to antibiotic when treating osteomyelitis in adults. Infections in children settle and multiply. The acute infection processes causes a rise in pressure within the bone that compromises blood flow and leads to the necrosis. Released cytokinesis alter bone integrity by promoting osteoclast activity. Eventually, the elevated pressure and the necrosis might cause devitalized bone to fragment from the healthy bone. Now, the most common organism causing hematogenous the most common organism causing the hematogenous osteomyelitis in children is Streptococcus aureus. In adults, the Streptococcus aureus is also most common causative pathogen. Gram-negative bacilli are responsible for increasing number of cases of osteomyelitis, and in children, infection usually is characterized by abrupt onset of high fever and chills. Diagnosis must be made on the basis of localized symptoms such as edema or now. Our next topic is acute osteomyelitis. What is acute osteomyelitis? Acute osteomyelitis is the clinical term for a new infection in bone. This infection occurs in predominantly in children and is often treated hematogenously in adults. Osteomyelitis is usually a subacute or chronic infection that develops secondary to an open injury to bone or surrounding soft tissues. Uh, it is mainly a disease of children's or the risk factors of the acute osteomyelitis includes poor vascular supply, recent trauma, surgery, diabetes, sickle cells, etc. The symptoms for acute and chronic osteomyelitis are somehow similar, which are fever like fatigue, nausea, tenderness, redness, swelling around the affected bone. There will be the swelling around the bone which is infected, the lost range of motion, etc. Okay. Then the clinical features. In infants, there will be a failure of thrive, restricted joint movement. The joint movements will be restricted, and in children there will be a high fever, which could be very high, almost 38.5 degrees centigrade or more. Child refuses to use limbs. It will be a pseudo paralysis, like a and its physical examination. Now, the physical examination may shows the bone tenderness and possibly swelling and the redness. So, and there will be different tests for the diagnosis and for in order to determine either the osteomyelitis is present or not. The different tests can be include, which may include a blood culture test, the bone biopsy test, the bone X-ray, bone count, MRI of the bones, ESR, CRP test, etc., and many more. Different tests are involved in it. Then the next heading is the treatment. treatment can be occurred through different procedures. First of all, I am discussing about the antibiotic therapy. Antibiotic therapy के अंदर क्या होता है? The bacterial drugs are important to stop the spread of the infections to the healthy one, to control the acute flares. The oral therapy followed by IV routes for 10 to 14 days. The antibiotics used in the treating osteomyelitis are amoxicillin, ciprofloxacin plus clindamycin, and the levofloxacin with the clindamycin. The antibiotics is continued for the 6 weeks with minimum and usually more than 6 months. The further description and the further detail and the further explanation about the osteomyelitis and my topic will be discussed by my group members. That's all from my side. Thank you.